In this ECHELON-1 study, which is really just sort of an observational study, basically what we wanted to look at is compare the real-world utilization and potentially future uptick of AVD versus ABVD, and to evaluate to see if the future uptick and anticipated uptick of AAVD reduce the incidence of patients requiring transplantation or other secondary sort of treatment options in patients with Hodgkin's lymphoma. In general, Hodgkin's lymphoma is an aggressive lymphoma, currently with options of AAVD, ABVD, and escalated BIACOP depending on the country of use. In this situation, from the original ECHELON-1 data, we know that AAVD provided an improvement in progression-free survival compared to ABVD. But obviously with the AAVD, there was a little bit higher incidence of infection rates and neutropenia, and so it does require GCSF. So uptick with AAVD has been a bit slower than anticipated, but in the community it is picking up. So in this, we did basically use a simulation model to sort of basically simulate what we anticipate would be the uptick of AAVD. And really to summarize things, what we saw is that with the anticipated uptick of AAVD, you saw more patients anticipated to be alive and progression-free without relapse. And also less patients having to proceed to secondary treatments such as autologous stem cell transplantation, other salvage regimens, and potentially allogeneic stem cell transplantation. So obviously this is a simulation model and not necessarily based on real data, but moving forward it gives some sort of sense of idea of the decreasing number of patients we could actually avoid some of these secondary treatments. Now moving forward, obviously we'll have to compare some of the savings that you'll get from avoidance of autologous stem cell transplantation to some of the costs that actually come with some of the extra supportive care that you need with AAVD.